The Texas Medical Board is disciplining a Lubbock plastic surgeon after finding problems with patient care, anesthesia, and record keeping. An agreed order against Dr. Thenapum Bunapat says he failed to meet the standard of care for two patients, including not properly treating a possible local anesthetic toxicity and performed large volume liposuction in his office that should have been done in a higher care setting. The board also says he left the operating room for about 2 hours during a surgery and didn't adequately supervise a licensed nurse giving sedation and kept incomplete medical records. Under the order, he must pass a jurisprudence exam, undergo 8 chart monitoring cycles, and complete targeted education.